What's the difference between a cochlear implant and a bone-anchored hearing aid, or Baha, and how do these devices help you hear your best? In this video, I'll discuss these two types of hearing device technology. Hi, I'm Dr. Derek, audiologist, audio engineer, and musician with ProFitHearing.com. If you have concerns about your hearing, always consult with your local physician or audiologist. When we have hearing loss, we experience reduced hearing sensitivity for different frequency bands. So for example, a high-frequency hearing loss impacts our ability to hear the consonants in speech. This reduces the speech clarity and it makes it harder to understand what someone's saying, especially in noisy situations. One type of hearing device technology is a cochlear implant. It's used to treat sensorineural hearing loss, which is caused by damage to the inner ear hair cells and/or the auditory nerve. A cochlear implant is surgically inserted under the skin near the ear, and an electrode array is inserted into the inner ear or cochlea. This electrode array electrically stimulates the auditory nerve, which overrides our natural hearing mechanism. In addition to the surgically inserted electrode, a sound processor device is placed behind the ear or on the head. This sound processor connects to the implanted electrode via a coil of wire and a magnet. The sound processor uses microphones to pick up all the sounds in your environment. This sound is processed and transformed into electrical impulses, which stimulate different areas of the inner ear or cochlea so that we can perceive sounds across different frequencies. Over time, the sound levels are adjusted as you acclimate and can tolerate louder sounds. Your brain needs time to adjust to this sound input, so you'll need to relearn how to hear and understand speech this way. A second type of hearing device technology is the bone-anchored hearing aid, or Baha. A Baha transmits sound with bone conduction, while a cochlear implant stimulates the auditory nerve directly. The microphones on a Baha pick up the sounds around you, process the sound, and then amplify the sound to accommodate for hearing loss. This amplified sound is then transferred to the inner ear through the skull as the Baha vibrates against the head. A bone-anchored hearing aid can be held into place behind the affected ear with a soft band, which is common with children, or it can be surgically implanted into the skull. One possible surgical solution uses an abutment or metal post inserted into the skull. The Baha device is then attached to the post. Another solution uses an implant under the skin. A sound processor device is placed behind the ear or on the head. This sound processor connects to the implanted electrode via a coil of wire and a magnet. Now, why would you use a cochlear implant over a Baha and vice versa? Your audiologist or ear, nose, and throat physician, ENT, can review your case history and test results. This will help determine what the best solution is for you. Let me know what questions you have about cochlear implants and Bahas in the comments below. To learn more about today's latest hearing aids, headphones, and audio technology, click or tap the screen. Thanks for watching, and I'll see you in the next video.